Good morning and welcome to the WellMed Charitable Foundation's Caregiver Teleconnection series. Today we have current issues in long-term care with Lucy Barylak, MSW, and Elliot Montgomery Sklar, PhD. Now I'm going to tell you a little bit about these two so that you know just how much expertise you're actually getting behind this presentation. Dr. Elliot Montgomery Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually on the internet. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work, the WellMed Charitable Foundation, and their clinics in Texas. In addition, on a personal note, Lucy would like you to know that she was a caregiver for her mother for almost 10 years. And with that, Lucy, Elliot, we're so pleased you've joined us today. Thank you.
Thank you. Hello. Welcome, everyone. Before we begin, I think it is so important for us to address a very important distinction in long-term care. And that is that we have nursing homes, which receive government funding, and assisted living facilities, which might most commonly are privately funded. And we are going to provide a lot of resources along our journey today and our discussion to help with that distinction and to help in accessing those government-funded facilities that we will be speaking about. Now, the reality is that most of us, myself certainly, I would not be able to pay for long-term private care. And this is a current issue in all long-term care, I think, across the board. Now, because many private facilities operate differently, their issues might be different, though some might be the same. For example, today we are going to talk about staffing issues, and there is a shortage of available staff across the board. But if one facility, as an example, is able to pay someone, let's just say $20 an hour, with better benefits than another facility who can only pay $15 an hour, well, you can imagine which job that candidate might take and who could blame them. So our focus today is really on issues affecting facilities that receive government funding, and this includes nursing homes and some other long-term care settings, which is why it is bolded here on our slide. While many of the issues that we're going to talk about affect both kinds of facilities, for example, like being able to handle advancing illness and patient needs, government-funded nursing homes are feeling the pinch. They're also the source of the data that we're going to talk about today, and other programs and research also refer to this data. So it's important, again, the distinction of funding, but also of what we know, because these private facilities are not subject to the same required reporting as publicly funded facilities. So the data that we have is from government-funded nursing homes because of these mandatory requirements. And it's very important to keep that in mind. So those two distinctions, reporting and funding. Mm-hmm. Now, chronic underfunding has been a long-standing issue in long-term care in the US. Even back in the 1980s, experts had warned that the current system, as structured, has been tested to the limit, that its functioning, and I quote, is inadequate, with serious problems in cost and financing, and in access to and quality of long-term care services. And it's a direct quote from a report on long-term care 40 years ago. And I would actually argue that all of these same challenges persist. Mm-hmm. Cost of care is a past, a current, and a future issue affecting long-term care and financing of long-term care is no different. They're very much intertwined. Now, pre-pandemic, between 2013 and 2019, the number of available nursing home care workers for every 100 patients in need had fallen about 12%. It's hard now to know the impact that the pandemic has had on worsening the staffing issue. But the AARP's long-term care dashboard has shown staffing shortages in long-term care to be around 21% at current. So that's the most recent data available. This is definitely down from when we used to report upon this during the height of the pandemic, when these staffing shortages ranged between 30 and 40%. Now, many people, a lot of younger people especially, are shocked to learn that Medicare does not cover long-term care expenses. The majority of people in nursing homes, in fact, have to use Medicaid to pay the bill, which is managed by each state. And so there are a lot of issues we're going to talk about today that are state specific, because the same issues are not true across the board. Now, what is true is that the average cost of nursing home care is about $400 per day. Now, very few people can afford to pay that out of pocket. And in fact, Medicaid does not pay that. Medicaid does not even pay half of that. Now, that is one of the reasons why long-term care facilities struggle so much. Financing long-term care is especially difficult because most of us are unaware of the issue and really ill-prepared for the risks that this poses. In fact, since doing many of these programs a couple of years ago, I've laughed and joked that I've been putting more into my retirement savings because I'm much more aware of the issues at hand, especially for myself and the risks that I have. So there are certain misperceptions and misconceptions, and I think that this really limits political support for new programs to address this issue, because a lot of younger people are not thinking that far ahead, and a lot of older people don't want to think about the need for long-term or nursing home care. And so in part, this is why we have so many caregivers, because we have to take on the role of providing long-term care for people so that they can age in place. And yet progress has been made, certainly, but slowly. Just ahead of the hour, Evelyn had talked about a lot of talk about long-term care right now on a national level. And the version of the Build Back Better bill that finally did pass in 2022 included $150 billion in federal funding to help provide the opportunities for higher wages and increased standard of living for the direct care workforce. Now, the funding was designed to permanently increase by 6% the funding that the federal government gives each state for in-home and community-based services, as long as the state creates a plan for strengthening and expanding those services. And so this is where it's important, again, to recognize that there is both federal and state funding. And because states manage Medicaid and states manage policies and laws related to healthcare, there are some national issues and some specific state issues that we will look at today from 3 states, in fact.
Well, thank you for that, Elliot. You know, in an industry that's always had a high turnover rate, the current workforce shortage has been really devastating. This is something we tracked throughout the pandemic with the help of the AARP's long-term care dashboard, which included data on staffing shortages. A 2022 survey by the American Healthcare Association National Center for Assisting Living showed that an enormous 98% of nursing home providers were experiencing difficulty hiring staff, while 87% face moderate to high staffing shortage. This is the newest national data that we have, but this is an issue we are still hearing about from experts in the field, as well as from caregivers and healthcare workers in long-term care facilities. Also, some of the issues and trends are different. depending on the state in which you live because of the health policies that relate to standards of care and coverage of care under state-led Medicaid programs. There are different population issues in different parts of the country, meaning there are places with more older people who need more care. There's also places where there are fewer staff, perhaps more diverse staff in terms of qualifications, meaning less experienced staff and different credential practices for healthcare workers. In the US, California, Florida, Texas, New York, and Pennsylvania are the top 5 states with most people aged 65 and over. Interesting. And changes to the individual state health policies as prompt focus on individual states and their unique long-term care issues. So that's really interesting to look at that about the aging population and the needs.
Absolutely. Is anyone surprised that these are the states with the top? Yes, Evelyn, you were surprised?
No, I was wondering national issues because this is the American Healthcare Association and the Center for Assisted Living. Is this nursing homes or is this nursing homes and assisted living?
It is nursing homes. Some assisted living facilities receive government funding because they have Medicaid beds. If they do, then they are required to report. So this really reflects, I would say, a majority of nursing homes and the minority of assisted living, that do have Medicaid beds.
Okay, thank you.
It's all based upon that mandatory reporting, and that's why the issue gets confused a lot too, because if you're a private facility, you don't have the same Medicaid CMS reporting that is required. And that is a big issue across the board.
Thank you. Who else? Anybody else want to ask a question, make a comment?
Well, keep these states in mind because we're going to talk about some of them. But what's most interesting is that one state that has the most progressive policy right now as it relates to this issue is not in the top 5 of having the oldest population at all. So I want to highlight, of course, my own home state here of Florida. And I've always loved this cover of the Time magazine from 1981. But as an example, we'll talk about Florida because some of the newest data comes from Florida. In fact, in March of this year, the AARP released a comprehensive report featuring Florida's nursing home staffing standards and current issues. And I think this is important to highlight as we are one of those 5 states with the topmost seniors, right? A lot of people also want to come and retire here. And I think that it's important as we think of our retirement plans to think of states and the level of care that they have, which is not something anyone puts on their to-do list when researching where to retire. So now, according to this report, staffing levels in Florida's 700 nursing homes have declined after changes to Florida law that have been passed over the past 2 years. So first came the Florida law in April of 2021, right at the height of the pandemic there, as we were vaccinating people, trying to. And this law created a new class of nursing home workers called personal care attendants. And according to this law, they could do the job of certified nurse assistants without training, but they would have to learn on the job. But there were no outlined educational goals, objectives, learning requirements. So then came a law in April 2022 that allowed for non-nurse employees who spend time with residents, like PTs, physical therapists, speech pathologists, and activity directors, to count toward minimum staffing requirements as it related to personal care and nursing. Both laws came as leaders in the long-term care industry said that they were having trouble recruiting and retaining nursing staff. Now, I do want to quote the AARP Florida State Director, Jeff Johnson, who succinctly summed up what these changes mean. And he said, the reality is there is a loss in quality of care that occurs when you try to reduce nursing staff requirements. The staffing standards are there for a reason. It's pretty clear that nursing staffing levels have gone down and no one has picked up the slack. In addition, lower levels of staffing detailed in the newly released report are a departure from the past when average staffing in Florida well exceeded the state's minimum requirement. And here's a look at the timeline of how staffing levels began to decline. So in April of 2021, when that first law came out, combined nurse and non-nurse direct care staff members provided on average 4.7 hours of care per resident per day. By April of 2022, when the Florida law about staffing standards changed, that time decreased to 4.55 hours of care per day per resident. And then by October of 2022, it had dropped another 8% to just over 4 hours per resident per day. So we don't have newer data than this. The report just came out this spring, and it includes data through fall of last year. I'm very concerned to see where our Florida staffing rates are now for residents, and I was curious to get some of your thoughts as to what you think about this example from Florida, and if we have any participants from Florida who want to share their thoughts as well.
So if you're on the phone, please press *6. I have this little website and I can see who has opened up their line. And if you're zooming in, please just, unmute yourself, go on the chat room, put your hand up. We would love to hear from you. It's pretty overwhelming, to think about the decline in taking care of our country's elderly.
And it certainly is concerning for me working here in Florida, because I've worked with seniors ever since I got my doctorate here 2 decades ago. And I also sit on the board of a HUD, low-income housing community that has a continuum of care into nursing home. And residents are aging out of being able to look after themselves, and there are no available nursing home beds. It's a crisis, really. Mm-hmm. And more people are moving to Florida, but no one is really thinking about this. And it used to be known as a place for people to come and retire. So these are things we don't talk about. We don't hear about in the news. They don't make a lot of attention because it's not a sexy issue. No one really wants to think about their need for nursing home care. And if they need it, they might want to consider a state that has better standards of care. Well, if you are living in Florida, I want to remind you that AARP Florida is calling for a lot of advocacy. We need to be lobbying with AARP in our individual states. And AARP Florida is calling for more research to examine the effects of state staffing on quality of care, not just data and statistics, but actual accounts of what people's experiences have been like. And I think this is so extremely important because some of the recent data also reflects times of crisis during the pandemic. And as a reminder, our national state of emergency for COVID only ended in this past May of 2023. Mm-hmm. So I think it'll be so important to see how things change.
Thank you for that, Elliot. There's so much to think about. I'm going to talk a little bit about Texas right now. So in April, AARP Texas called for Texas legislation. I'm getting a little bit tongue-tied. Legislation to approve a new bill to reform nursing homes in response to disappointment about nursing home quality. Thousands of members across Texas signed a petition urging legislative actions on nursing home quality. And through a survey, members explained their family's experience in Texas nursing home. Among concerned mentions were long wait terms for their families. Among concerns also were urinary tract infections, errors in medication schedules, unexplained injuries, and bed sores. A common issue was low staffing and high turnover of staff. Studies have shown that nursing home staffing is highly correlated to the overall quality of care. Low staffing can be linked to many of other concerns reported. So it sounds, that's exactly what it is. If you don't have enough people to care for other people, certain things can happen. And we know that poor staffing levels can lead to inadequate care and often even neglect. Many nursing home residents have poor mobility, and they depend on staff to use the restrooms and get physical activities. So low waits to use the residents increase risk of urinary tract infections. Being left unattended in bed with little movement can cause bed sores. It's kind of a type of a skin ulcer that was mentioned several times in the AARP Texas survey. If a resident cannot rely on staff to help them, they may try to walk on their own, leading to injuries. They can actually fall, and then there's hip injuries, broken bones. You can just imagine. Neglect from staff can harm the mental and the emotional state of nursing home residents. Loneliness is a significant problem. It really is in nursing home. Limited interaction from staff means limited opportunity for socialization. So even if they have activities going on and they don't have enough staff to get people there, this is what happens. So this new bill in Texas would require nursing homes to spend a certain amount of public funds on direct staffing. Ensuring that funds go to improving staffing is an important step in improving the overall quality of care. So this is very interesting what's happening in Texas. And I was wondering, does anyone have any experience that you've experienced yourself, if you do have someone in long-term care? And how do you feel about this new bill being proposed? Do you think it's going to make a difference?
If you're on the phone, press *6. I can see that you've unmuted yourself. And if you're Zooming, please join us. Do you think it'll pass?
I don't know.
That's a great question. It looks like it should, but you never know.
I'm not sure the legislature gives that much credence to AARP.
That is true. However, I think because of the number of people needing nursing home care, hopefully the AARP will have drummed up enough people to help advocate, not through them only, but in voting and in
writing their congressman, their
that's
state
it.
legislature. Yeah,
that's it. And I think that is one takeaway that we really hope from today, is that we need to all be advocating for ourselves and for others in our community.
I have someone who would like to talk to us.
Sure.
Area code 443, please go ahead.
Yes, good morning. I was interested in finding out for caring. I was wondering why they don't have a program on training for the family, because we used to live 3 generations in a household. So we didn't have as much need for a nursing home, because the family, the generations took care of each one of the generations. And we need to get back to that. And since they have such wonderful caregiving programs, I don't understand why the federal government doesn't partner up with people who are being caregivers to do a little bit more in assisting them in the work that they do, helping them, because we caregivers keep the country from going bankrupt because you couldn't hire enough people to take care of the people who need to have the care taken, and they seem like they don't really want to work with the people who are doing the stuff for free. Every little thing you ask for, no, they can't help you with that. They can't help you with that. So unless you have family that can help foot that bill, you can't get it done when it's not that much money.
And I think, you know, in my experience, this has a lot to do with the whole panorama of long-term care services. You know, a lot of people want to stay at home, but they need extra support to stay at home. And there are some Medicaid waivers that help with that. But again, Medicaid is income related. And I can't tell you how many people I've known who have $4,000 in the bank. And it used to be that that you could only have 2,000. So they were not eligible for Medicaid. And they didn't want to spend that $4,000 because they were saving it for a rainy day. So it's a real conundrum.
It's
Anybody
a
else?
horrible.
Okay, so if we
Please.
work with families to make them more caring and compassionate, some of those family members who are in nursing homes are not people who actually need a whole lot of medical. It's just nowhere else for them to go because they have no connection with any other people in their family or their community.
Or they're too much for the family to care for. You know, the 24/7, dementia folks, nobody can do 24/7 if you're just one person.
You're making a very good
Right.
point. You're making a very good point, what you're saying. But I also feel that the whole issue of families taking care of each other, things have changed so much now. I have 2 daughters and I could see both of them. There was a time when women could stay at home and raise families, and now people, at least there has to be 2 incomes coming in many times. And so it kind of changes the dynamics of the family as well. But I totally agree with you that there needs to be some policies in where if you are willing and able to care for someone at home, to have more support financially for sure, and more support physically, like things that you may need. So I cannot speak to that because I'm not in the States. I can only tell you in certain provinces in Canada, especially in the province that I live, yes, they have put in resources to help caregivers financially as well, not as much as they should, for sure. So your point is well taken, but I can't address that as far as the United States, Elliot. I don't know if you have more to report on that.
Well, I think the caller has summed up so eloquently the experience of caregiving for a lot of people. And we do need better support, education, training. That's the very reason why the WellMed Charitable Foundation exists and we have these programs. But this is just part of an overall initiative that I do think needs to be better coordinated at a national level. There do need to be training programs. For example, I know where Lucy is in Quebec, for people who are unemployed as an example, and there are free training programs to help get you back to work. One of them is on caregiving and being a professional caregiver. In the United States, these efforts are more fragmented, but something that you might want to look at, for example, the Alzheimer's Association, because it has a lot of funding, does have education programs that are disease specific. Some of the other disease specific foundations have similar types of training. But among universities, there are 2 designations that universities strive for, and those are Carnegie Foundation designations. One of them is to be highly community engaged. And as an example, the university for which I work, Nova Southeastern University in Florida, is one of those institutions that is highly community engaged. And we have a number of training programs for caregivers, in addition to support programs through our psychology department. There are on-campus institutes and training days through a lifelong learning institute that the university has and other initiatives. So It is, though, up to those individual caregivers to seek out those opportunities. And I would recommend that many people do check out what your local universities might have in the way of free education and training programs. Community colleges do the same. But it's such an excellent point, and I want to thank you for that.
And Elliot, if I may, we do have federal funding that funds the National Family Caregiver Program through the area agencies on aging. And as we've said many times, call 211, find out where your area agency on aging program is at, call them, get any information that you can, because they do have educational programs. They have a tiny bit of money for respite. It's quarters next to Medicaid's billions of dollars. So
Right.
It's a small program.
Right. And there is an evidence-based program called the Stanford Chronic Disease Self-Management Program that a lot of community organizations run for free. Another is called the Matter of Balance. It's a falls prevention program. So there are some evidence-based national programs that communities do provide. And again, I will provide those resources at the end. But as Evelyn said, call 211 in your local community or reach out to your local area agency on aging. Now, I want to ask Lucy, what are the implications here for caregivers in light of these staffing issues?
I think there's many implications for sure. If I look at myself, when I was caregiving, there's a lot of fear. You wonder what's going on. You might be scared to place your loved one in a facility, and there might be a lot of guilt that's part of it also, and anger too. But I think it's so important to keep in mind that if you are no longer able to, you do have some choices. You can do some research. So first you need to know what is actually going on in long-term setting. This is one of the things why Elliot and I felt that it was so important for you to have a better understanding. So Elliot said education, it really is important. And if you're you need to look around. You really need to check out. And if you go to facilities, ask about their staffing, if there are, exploring options. It's important to also speak to the staff when you go there, with the residents, for those who can actually communicate with you, or other family members. Ask them, what's going on? What is your sense about this place? And if you do place the person, keep open communication with the staff. If you have a loved one there, ask them how they're doing. And, from time to time, maybe bring a little treat or a little something. It's that whole connection with staff so they know who you are. And hopefully that will engage them a little bit too. When they do spend the time with the person, with your loved one, there's a different kind of a sense of a relationship. So it's also important to make sure that the basic needs are attended to. Like we talked about personal hygiene. All these issues of bed sores and falls and all that, it happens because sometimes people are not being taken care of the way they should be, or there isn't time to take care of them the way it should be. So be sure to communicate concerns that you may have. Follow up with those concerns. Write everything down so everything is documented, and there's evidence in case you need to make more significant actions. And sometimes you can yourself come with some solutions that you may have noticed as well. Now, I know that for many caregivers it's difficult, but visit as much as possible. With the understanding that the staff may not be spending as much time with your loved one. Try to find ways to stimulate the person that you're caring for. You can do activities at the setting and encourage other family members and friends, if they can, to visit as much as possible. Sometimes it's really good to come around meal times because there might not be enough staffing if the person needs to be fed or encouraged to eat. So kind of have a good understanding of how things are managing. yes, you can complain, but like look at it in a positive way of what you can support or not. Now, Elliot talked about advocating for your care recipient. That is so important. You know, that's one of the roles caregivers always have. So keep your eyes open and your ears open. So report any situation of abuse and neglect. That's very important to the ombudsman. I'm not going to go into detail, but every facility has an ombudsman. And one of the things that I think as an advocate, what you can do maybe on a personal level is maybe create a self-help group with other family members. You can ask if they would like to get together, not only to complain, but to look at solutions. And there's a real force when there's more than one person talking about whatever is going on. It's a way of having a united force. So I know Elliot's going to talk a little bit more about other things that you may be able to do. But the reality is that unfortunately, in many of these places, sometimes caregivers do need to hire extra help around certain activities, and some of them could be around meals, around bathing. That's a big issue, and toileting, things like that. So these are some of the things that I think are important to look at. So as I always say, once your loved one goes into a facility, you don't stop being a caregiver. It just changes the dynamics a little bit. All it really does, your concern is still there, especially in this environment now. But at least you can go home, hopefully, and have a good night's sleep and have some respite.
And the tip that you mentioned, Lucy, also about, I think, alliances in a way is a good one. I have a former colleague whose mom has Alzheimer's, and recently they placed her in a nursing home. And she and another caregiver that she met in the hall, whose mother was recently placed there, they sort of just naturally, because of the time that they visited, established a little bit of a bond. And what they decided is that to make each other's lives a little easier, they'll each go there once a day. One goes in the morning, one goes later in the day, based upon their schedule. And they look after each other's mom, make sure that they eat and, that they have some stimulation, have a visitor. And it takes a little bit of burden off of each of them. And that's the solution that they came to, which has been helpful.
Yes, that's part of advocating for yourself and advocating for the person that you love. Thank you for
Of course. I'm just being sensitive to time and some other things we wanted to go over. Another implication of all of this, and I alluded to it earlier in regards to my role in a board in a housing and urban development low-income senior community here in South Florida. So this other implication of these staffing shortages in long-term care is that they're reducing admissions. And that is a very significant implication. This is a major issue right now that people should be aware of, especially for those who work in healthcare as well with seniors, because we know that it has always been more challenging to get into a government-funded nursing home, but that might be even more so the case right now. So it is very important that people get informed. And if you have registered for today's program, you'll get a copy of our handouts. And the text that you see on our screen here that's underlined and in purple, these are hyperlinks. And you will actually be able to follow those and visit the Medicare.gov website to look at nursing staffing levels at nursing homes in your local community. It's an incredible tool to have for caregivers and for healthcare professionals. And you might want to be looking at your nursing staffing levels. Now, I mentioned earlier in our program that issue of mandatory reporting of data. Well, this is where it comes back to be so helpful because it allows us to know what's going on in our communities. So if you visit the Medicare.gov site, you can access the nursing home compare portion of the website for information on inspection surveys and other information that also includes staffing levels, complaint investigations, and general facility information, including actually the number of beds, which is helpful too. I took some time going through it and found that there are some facilities with a very small number of beds in very large communities and vice versa. So just as Lucy was recommending, if you're looking for potential long-term care facilities, take time to visit the facilities that you're considering, talk to an administrator, take a tour. While you're visiting, observe the staff, see how they interact with residents, if they know people's names. The idea of visiting at mealtime, I think, is an excellent one because we know how important food is, especially in long-term care settings. And you can certainly talk with residents and family members to find out what they like or don't like about the facility. Another idea also is to visit the facility on weekend or evening hours when they might have further reduced staffing to see how things are going. Now, it can be very beneficial to begin this process as early as possible. Starting the conversation early allows your loved one too to participate in that decision-making process, which is important. And I know no one wants to have these conversations, but they are important ones to have. So if you do feel like you need a social worker or a mediator to help with the process, your local area agency on aging has those resources as well. And also beginning the process early can help to alleviate some of the stress and tension that we know that declining health causes for caregivers. And it's also important because these wait lists for Medicaid beds can be long. So getting on those lists early is important. And that circles back to why I think it's important for healthcare professionals to know about the staffing levels in your local nursing homes so that you have a sense of the level of care that a facility can provide, as well as to also gauge potential wait times or reduced admission that might not be otherwise advertised or communicated. I also want to mention that Lucy and I hosted a series last fall called Aging in the 21st Century, and you can find that on the Caregiver Teleconnection website as a recording. In that series, we talked about issues related to aging in place and finding long-term care, and also about the process of getting a Medicaid bed, which could take up a whole hour of our time as well. So feel free to peruse that recording. I did want to quickly ask if anyone had any comments or any questions. Yes?
We had another podcast when people are on looking at yours that was maybe last month, and it was from the Healthcare Improvement Institute, and it actually was called Starting the Conversation. And there is a conversation kit that she refers to, and it's really about how to talk of, rather than talking about death and how you want your death to go, it's talking about living the way you want to till the end of your life.
That's such a great way to frame it.
Well, you know, this issue also affects healthcare workers deeply. I really have to say that. Those in community setting have different clients' needs and concerns, especially in light of nursing home admissions being reduced. This means more time is spent at home many times, and people don't go into these facilities, which can be, as you asked me before, what implications does it have on caregivers, which could be a big burden in itself, especially if caregivers cannot continue caring. You know, we also heard from healthcare workers in long-term care setting who have too many patients on their caseload to manage well. It's really important time to make sure that you care for yourself as best as you can. So I'm talking to you, healthcare workers. Having a supportive work culture is so important for leaders to create that staff in long-term care setting feel valued and supported, and hopefully that there's an open door for concerns to be addressed. We need new models of care, more funding, and change across the board. as a result, I think we are going to see a continuing expansion of what are known as green or family style nursing homes. Okay. Now, I'm also looking at the time, Elliot, so I don't want to go into too much detail, but just to tell you a little bit, a greenhouse or family style nursing home is a model that is very exciting. They have small locations of care with only about 10 to 12 people receiving care. It's personalized. It would look more like your living room than an institution. The funny thing is that this style of nursing home is actually something that was common through the 1930s. These smaller facilities used to be called old age homes and were often operated by religious and ethnic organizations who felt it was their mission to care for their own. So very much what one of our participants was talking about. So maybe that's kind of another way to approach that. They have universal care workers who not only help with their activities of daily living, but can support the family members as well. It's almost like deinstitutionalization and personalization of care sort of coming together. These facilities fared much better during the pandemic. There were some of them during the pandemic because of the lower number of residents, but also because of having private rooms, bathrooms, and accessible outdoor space. All of these were cited as reasons for fewer cases of COVID. But this would also be true for other things like the flu and things like that. So I was just that's a very quick kind of a picture of what they're looking at. And I think these are really maybe wonderful alternative to big institutions where people can actually kind of get lost.
Yeah, and I was saying earlier that on the Medicare site, I saw some facilities that only had 10 beds as examples. So there are some of these facilities that are publicly funded. They do also have more staff per resident and more staff time per resident, which is so important. And I had mentioned I wanted to highlight an example from one state that is not on that list of top 5 with the largest amount of seniors, but I think that this is a very, very unique and novel approach here that Washington State has created, what is called WA Cares. As we know, WA is the abbreviation for Washington State. And what it is doing is helping people with funding long-term care. So when someone needs help with tasks like managing medications, making meals, bathing, dressing, they can tap into what is the WA Cares benefits first before they have to rely upon their savings. And I think a key here is that you can also pay a family member to be a caregiver. So they also pay for home modifications like ramps, grab bars, walk-in showers, medical equipment. And how this works is that workers contribute 58 cents on every $100 earned while they are working into a fund. And these contributions end when people retire, but their benefits keep growing until they need it. So for example, a 45-year-old worker making $50,000 a year will contribute about $5,800 if they retire at age 65. So that's over a 20-year period. But their benefit grows with inflation and would be about $55,000 in another 20 years. So you can almost think about it like unemployment benefits that we pay into, and if we need to access them, they're there for us. And the benefit depends again on the contribution. So it's like a long-term care savings program, but it's mandatory so that the fund is there. There are 13 other states, including California, Arizona, Illinois, Michigan, New York, and others that are following Washington's lead and considering this universal long-term care coverage through a supported tax allocation. And I think this is a very interesting model. I'm going to be very curious as time progresses to see how this works, because this has passed. This will become available to people, I believe, in 2026. So some key takeaways very quickly in the interest of our time today. I think that there's a lot still that we need to learn. Obviously, we couldn't cover everything in this short time together because there's so many different state issues now. It's not just a national issue. There are a lot of factors in different states that are linking to quality of care. Now, a majority of us do not have savings adequate to pay for the care that we will need. The median American today has about $5,300 in savings, a little less than that. 32% of Americans have no savings, and that's according to the Federal Reserve. So private long-term care insurance premiums, they rise with age, and insurance companies are charging women more than men and denying coverage to those with pre-existing conditions. So don't bank on getting that. In addition, households of color have less access to saving mechanisms and have less of a buffer to prepare people for care. So there are inequities across the board. And about 90% of people don't have private long-term care insurance, which leaves people, as you said, Evelyn, earlier, caught between a rock and a hard place. Either drain your assets and savings to qualify for Medicaid or go without the care that you might need. It's time for us to recognize that healthcare workers are essential to our economy and to helping our families exist. And our loved ones really deserve high quality care. And so I think that sums up nicely the things that we need to be advocating for in concert with our state AARP. Also work with your local area agency on aging to get local information and to see what things you can do locally to help advocate. I think that this is such an important issue for all of us because we don't know at this point who might need care down the line. And I'm going to leave you all with some resources here on how to access the AARP, your area agencies on aging, and that very important Medicare care comparison to look at the staffing levels at specific facilities. Does anyone have any questions before we hand it back over to Evelyn?
You have a last chat.
That was Minerva that I see.
Judy asked the question, how can we inform ourselves about the Medicaid qualification requirements in our state?
Excellent question. You can look that up through Medicare's care comparison as well. They have links to Medicaid in your state. Area agencies on aging here, their website will also have information because Medicaid is state specific. And in that recording that I mentioned that you can find on the Caregiver Teleconnection website from a program that Lucy and I did last fall, Aging in the 21st Century, I believe it was part 3 on what you need to know on finding long-term care. We go into Medicaid eligibility in detail, as well as a pre-screen tool to see if you are Medicaid eligible, which is a great resource to pass along as well to clients if you work with them. And it's important to take that pre-screening to see what you might need to do or whether you would qualify or not, because it is an involved application.
Thank you. Does anybody else have a final question or a comment or experience they'd like to share with us? Okay. Oh, from Judy. Oh, thank you. Yes, all right. Well, I'm going to do a little housekeeping. We may still have time for one more question, but I want you all to know that if you are not registered for this, you won't get those resources, but you can get them by calling our WellMed Charitable Foundation customer service representative. And that number is 866-390-6491. And that will register you forever, basically, with the WellMed Charitable Foundation's Caregiver Teleconnection. And so you'll not only get the resources from today with the post-session questionnaire, but you'll also get monthly calendars. And boy, have we got some stuff next month. I'm going to tell you about a couple of them, because I think that many of us have wondered about these topics in our lives, in our caregiving lives particularly. So we've got Ask Dr. Tam, and she is a dementia expert. We have When Caregiving Ends. We have a Spanish presentation on agitation in dementia with Dr. Predario. He's a geriatric psychiatrist. Why does dementia cause hallucinations, delusions, and paranoia with our dear Lucy? The other dementias with Dr. Samuel Brickman, anxiety and health science of the brain. Anxiety and new, I should be wearing my glasses. Anxiety and the new science of the brain. And I'm going to do that one. I'm not a neuroscientist. I want to say that. Dementia, stigma, and caregiving with Dr. Natalie Oliver. Moving away from the idea of codependency. And I think we've had kind of a buildup to this from Dr. Jamie Heisman over the last couple of months. What to know about the new treatment for Alzheimer's disease with Elliot Montgomery Sklar. So we have quite a month here, nine in the 1 month, and we will be looking forward to having you join us. I want to thank you all for what you do every day. I want to thank the WellMed Charitable Foundation and, of course, our illustrious presenters, because they work so hard to put these things together to make sure that you have the newest information and you know what needs to be done in terms of advocacy for yourself and for your loved one. And so,
And we might all want to think about retiring to Washington State.
Actually, I think a lot of states have different stuff. You know, it's really important to investigate. Like California has this huge in-home supportive services program, which spends millions and millions of dollars and provides up to 286 hours a month of in-home care. But again, it's Medicaid qualified. So that's the issue is, you know, are you willing to spend down, not knowing what's going to happen in the future? Anybody else have a final question? All right. I think you guys are going to stay on, right? You want to talk about that a little bit?
It was not on today's calendar, but if anyone has any questions that they have, we're happy to answer them.
It is on the calendar.
Is it? I thought it was our session after caregiving, life after, or when caregiving ends. I'm sorry.
Yeah, well,
I'm happy to stay on if anyone has anything they want to talk about.
Okay. And I am going to log off so people can, you know, have their personal support if they like it. I am going to stop the recording at this point. I want to thank the WellMed Charitable Foundation for the support that they give the caregivers, the education, you know, the clinics, all of the stuff that they put together to really try to help caregivers, you know, have a better life. So with that, I thank you all for joining us today, and we hope to see you next month. We have many good things. Okay, bye-bye.
Thank you so much. And if you would like to stay on with us,